Welcome to Eat This, Lose That. We have Dr. Khan as our special guest. As you know, he works with me and he's a primary care physician. He's an excellent primary care physician, and today he will be talking about flu and its relationship to heart disease. And lately, if you've heard or not, there's been a lot of talk about patients having influenza or patients having cold or flu-like symptoms and also finding themselves with heart attacks or significant damage to their heart muscle where they are going actually into the hospital with congestive heart failure. So with that said, we'll first talk about flu, we'll talk about other respiratory infections, other different viruses, and is there a relationship between cold and heart attacks? So Dr. Khan?
All right, first of all, we want to talk about the seasonal flu. Seasonal flu, as we know, it's a self-limiting viral illness caused by the influenza virus. There are different types of influenza virus, but the most important thing you need to know, how do we get the influenza? What are the symptoms? How can we prevent it? And what complications can it cause? This virus is most of the time we get this virus when somebody who is infected with influenza cough and sneezes, and most probably because of the droplet infection, air droplet infection, we can catch this virus. If you are within the 6 feet of the person who is infected, there is a high chance that you can actually get this virus. And also, if you're touching the surface where the person infected with influenza actually cough or sneeze, and you bring it to your mouth, you have a chance of getting the infection as well.
So when you say 6 feet, so Joey is standing there probably 6.5 feet. So if I have influenza and I sneeze vigorously, there's a very good chance that he'll get it. Two, if my droplets fall here and Joey comes here and puts his hand here, that means he can get it. Now the question is, how long does the virus stay alive once you cough and sneeze?
I think it's 1 to 2 days.
So that means when you go to a hotel and stay at a hotel, you have no idea when you're picking up the remote and using it, if the guy had flu and has been sitting there using the remote, and you just go pick up the remote, and then next thing you know, you could be getting the viruses from these guys.
Absolutely, Dr. Reddy. That is the possibility.
Especially in the hotels.
Hotels and the public places, and whenever you go to the Walmart and you're holding the card, you never know. Absolutely, you never know who's been holding it before and who's coughing and sneezing on them. That is a huge possibility. The incubation period, Dr. Reddy, is 1 to 4 days. And if the person is infected, there is a good chance that you can actually get the virus within the first 2 days. So he doesn't know this. He doesn't know that he has symptoms of flu. So for example, if I'm infected, as a primary care physician, I'm seeing a lot of patients with the flu. So for example, if I'm infected today, I don't have any symptoms.
But you could be transmitted the virus to others.
Absolutely. That's the one way of getting the infection. Once you have an infection, then you're looking at the fever, the symptom-wise. You get a fever, you get a...
But before we go to infection, so what should a person do knowing what they... Now that you mentioned that if you sneeze, you have a good chance of getting it, then if somebody sneezes in front of you, there's nothing much you can do about it because it's going to hit your face. 2 is you touch something, you don't want to make sure, meaning you want to make sure that you don't touch your face with the hand. So what do you recommend patients to do?
First of all, you have to wash your hands at least 20 seconds. That's by literature. Use water and soap and wash your hands for 20 seconds. If as a patient, as a physician, if I encounter any patient, I have to make sure that that I wash my hands after every encounter and before every encounter. And secondly, if you are infected, you make sure that you cover your mouth whenever you cough or sneeze, because that's the one way that I can get protected. Because if you have flu and if you're coughing and sneezing and you're not covering your mouth,
then you're spreading it.
You're spreading it, and I have a high chance of getting it, because not only it start 2 days prior to you having the symptoms, also it will last up to 7 days while you're having the symptoms. So during those 9 days to 10 days, you're still shedding the virus.
And you're exposing your family members, friends, and co-workers to the risk of infection. So not only during the incubation period where you don't show the signs of infection, you're shedding the virus, but you're also doing it when you're actively infected for another 5 days.
Another 5 days. And you're spreading the virus, and specifically, not only the co-workers and all those, if you're going out to shop, or if you're going out to some other places, you have to make sure if you cough or sneeze, you cover your mouth, because you never know you're maybe
spreading the virus. So what do you think about going to movie theaters? Because most people, when they're sick, they take their kids to movie theaters. So you know what, sit there and watch a movie.
Then avoid the movie theater, Dr. Reddy.
I'm just saying, be careful of what you're doing.
Absolutely.
Because people don't seem to realize that we are seeing a lot of people coming into the office with flu-like symptoms. Either they have flu or they have cold, not flu, but there are a lot of people coming in, and we are also hearing a lot of people dropping dead or getting admitted to the hospital with congestive heart failure, and when they evaluate the heart, they find that their heart function, which normally is around 60 to 65%, is dropping to 10 to 20% in healthy young individuals. And you're also seeing young, in fact, didn't you say there was one person who actually dropped dead on the day when he was diagnosed as having influenza?
Yeah, the next day it was on the news.
Within 24 hours.
Exactly, within 24 hours. That's where the most important thing, Dr. Reddy, is to protect yourself and also your family members if you're diagnosed with the flu, because you're right. And then, having said this, I want to say one thing also, that there's a lot of discussion we're going to do about the symptoms and also about the vaccine. We also have to think about the prevention as well,
right? Because
prevention is another most important thing. When Dr. Reddy mentioned about how to protect yourself from getting a flu, we are talking about the prevention here. We are also talking about, we will talk about the vaccination a little bit, in just a little bit we talk about the vaccination, but remember, the symptoms are the most important thing. And if you start having the symptoms, at that time it's either you have option, either you go and check with your physician and get a flu test to make sure you have flu or not.
How quickly should I go to the physician?
Right away, Dr. Reddy, because first 48 hours are crucial, because if you are diagnosed with the flu, then the physician has an option within the first 48 hours to start you on the medication like Tamiflu. So if I have symptoms of fever, headache, fatigue, sore throat, runny nose, I should go and get myself checked. It's a simple rapid flu test. The physician is going to swab your nose, and within 15 minutes he can give you the answer whether you have a flu or not.
So let me start again. So if you're having flu-like symptoms, that is fever, chill, do you have chills also? Just fever, headache, runny nose?
Fever, headache, malaise, you have scratchy throat, you have runny nose.
When that happens, go see your doctor immediately with one question. Do the flu test.
Absolutely.
And basically you swab the nose and find out if you have it or not.
Absolutely.
And within 15 minutes you'll know. If you have it, you probably have influenza A, correct? So if it is negative, it doesn't mean that you don't have influenza B. Am I right so far?
Yes, the test can actually tell you about influenza, and if you have influenza, there are 3 types of influenza, A, B, and C.
That is correct.
And then we also have influenza we talk about the cattle, sheep, and remember about swine flu and the bird flu and all those. So that can always cross-react if you're working in the farm and you catch that flu.
But those are not as bad as influenza A, which you see. Now, the first thing is they need to come to see you or a primary care physician to find out if they have influenza A or not. But they still are suffering from cold. Am I right so far?
Absolutely.
Now, before we go any further, I just want to talk about washing hands. You said 20 seconds of washing. That means what? You put the soap on and scrub very well, and then wash your hands under water for 20 seconds. Running water for 20 seconds.
Doctor.
That's pretty long wash, and you just don't put it there. You completely make sure that you clean yourself.
Absolutely.
I'm just trying to make sure that people understand, because they go in and do this and walk out, but you have these areas which are not cleaned properly, and you still have the virus and you're still exposing yourself.
Absolutely right, Dr. Reddy, because that's the one thing that you mentioned, a very good point. When you are in a hurry, you just go and do it like this and you think you have already cleared your hand. But there are certain areas which need, that's why the 20 second is so important, to make sure you reach all the areas and clean them. Otherwise, you may be transmitting the infection.
And one of the reasons you want to put the soap is because if your hands are oily, then putting your hand under water is not going to get rid of the oil, and so the virus, if it's stuck to the oil, is not going to be washed off. So unless you get the soap and the water to do its job well, you're not going to get it out. So sorry, enough on hand cleaning. So now let's go to the next point. So what do they do after they come to see you? You do the test and you find out they have flu, and you said that they have to come within the first 48 hours, because if they come 50 or 60 hours later, then the medication is not going to work for them, the Tamiflu, and they are now condemned to suffer the consequences of influenza A for at least a minimum of 1 week, and if they have complications that can go even longer.
Yes,
right? So
yes, absolutely, Dr. Reddy, because if you are within the 48-hour window, then we can start the medication which you have to take, 1 in the morning, 1 in the night for the next 5 days. Medication reduces the flu symptoms by at least a day or two, and also reduces the complication. That's the most important thing. Complication is the one area where we also have to focus, because you can get pneumonias, the brain can be affected, the nerves can be affected, and recent studies have shown that heart can also be affected. Again, there are certain people who are at risk of having more complications. We are talking about the diabetic, we are talking about the people with the heart disease, liver, kidney disease. Also, people who are 65 years and older, they are at risk because their immunity is weak. And remember, the children 5 years and younger, and specifically 2 years and younger, because their immunity is young and is still learning. So those people still have a chance of having complication, and those people with this different comorbidities. So that's why it's so important to come early and to actually taking care of this. But again, the question is that how we take care of the pneumonia most of the time. Is it rest, push fluids, and that's...
But let me start again. So from what you're telling me, it is the extremes of age. If you're very young, you're at risk for complications. If you're over 65 and older, you're at risk for complications. If you're in between but have diabetes or kidney problems or immunocompromised or low white count, you are under enormous stress, you are at risk for complications. So having said this, now you're saying about treatment.
The treatment, again, Dr. Reddy, that as we all know, most of the time the viral illnesses are self-limiting diseases. So you have to make sure that you rest, you actually push plenty of fluids, and then try some Tylenol and medications like Tylenol for pain and fever. But the most important thing is in all these viral illnesses is to rest, is not to stress the body. That's the first most important thing.
If I get sick, why can't I exercise? Because I see a lot of patients who say, I'm sick, so I'm going to go to the gym and exercise and work out hard to make sure I can beat the infection. But
Dr. Reddy, the most important thing is body is already under stress. And those stress mediators or those inflammatory mediators are already circulating in the body. Whenever you're sick, you need to rest. You don't want your body stores to work against fighting the infection. You do not want to deviate your energy in other activities that you want to do. Number one thing. Number two thing is, now let Dr. Reddy explain the number two thing, because we are talking about oxidative stress and of impacts on the vessels and the heart and all those things.
I agree, but I just pose a question because I have seen quite a few patients with cold. When they come to the office, they say, I'm going to go to the gym and exercise. I said, that's a wrong idea.
That's true.
When you are sick with cold, doesn't matter what virus, it could be influenza A, B, C, or respiratory syncytial virus, or it could be other respiratory illnesses, whatever viral infection you have, it is a time to rest and not to exercise. Why would I say that? Almost 30 years ago, they did a study where they looked at medical students. And what they did was they did the ultrasound to find out what their heart function was. And then when they had cold-like symptoms, they went back and did an ultrasound during the cold. And what they found was during cold, their heart function actually dropped by an average of 10%.
Oh,
so if your normal heart function is 60, you drop to 50%. That means, why would your heart function drop? That means, is the virus directly affecting the heart muscle and causing some sort of mild cardiomyopathy, which in turn is causing your function of the heart to drop? And that's why the old grandma adage says, if you're sick with cold, stay in bed, lots of rest, lots of fluid, and eat some chicken soup and rest to recover.
Also, if you are infected, you want to rest and do not spread the virus. That's another most important thing to remember. Because if I'm sick and I'm coming to work, then I'm going to be infecting Dr. Reddy and all my other colleagues as well, and they're not going to be happy about it. So it's most important thing to rest. It's most important thing, just like Dr. Reddy said, you push fluids. And if you don't do that, then you are at risk of those complications that we are talking about, because body can handle to a certain extent. And also, during the flu season start, which is actually start end of October and last up to March, sometime it go up to May, and the time when you can actually have a higher incidence of flu is between November to February. Having said this, the vaccination is the number one important thing that CDC keep on recommending, but there is always a discussion in the media and also about among the patients that I've seen, is it worth it? Is it really accurate? Remember, flu is a very intelligent virus. It changes its antigenic composition every year. And that's why
it continues to evolve.
Yes, Dr. Reddy. It's a very intelligent virus, and that's why it's hard to predict the strains. But again, getting a flu vaccine...
So what is the role of flu vaccine? Because I heard reports saying that flu vaccine is only good in 10% of cases this time around. And didn't you say that CDC mentioned that the flu is not stabilizing, it's actually accelerating its spreading. The way it is spreading, it's actually the number of cases are going up and not going down. And two, is it true that only 10% of patients are being protected by the flu vaccine and 90% are not getting protection from flu vaccine?
Dr. Reddy, it's all about, again, it's not 100% absolutely right that the flu is a smart virus which is evolving, but getting a vaccine prevents you from complication and prevents you from the severity of the disease. That's also mentioned in the literature. Now, if you have any serious reaction to the vaccine, then you should not get it. And people also have a question about the egg allergy, which you can actually consult with your physician. But again, this is a smart virus, and at least getting flu vaccine every year, you still have an immunity. And some years we have a poor predictability, but some years the cases are low.
So your recommendation at this point is, even if it is 10% protection, get the flu vaccination, because that will still at least decrease the chance of you developing complications.
Complications and also the severity.
That's the severity of the disease. Absolutely. So even though it may not protect you from the disease, but at least decreases the severity of the disease.
Severity and the complications.
But remember, if you do simple things, washing your hands, making sure you don't put your hands on your face more often, and making sure you sleep well, hydrate yourself, and eat well, and unload stress, you tend to improve your immunity, because if you're under enormous stress, your immunity is going to go down. And once it goes down, what I'm seeing now, is it true, more patients are coming in sick, but they're not just sick, they're getting sicker, and they tend to cough with, they tend to have symptoms of cough for almost a month.
Yes, Dr. Reddy.
They are not recovering. So Dr. Singh, who works with us, has been telling us about the patients he's seeing in the hospital with young people coming in with congestive heart failure and dilated hearts. That's not a good sign. 2, we are seeing people, instead of the course staying for 7 days, it's going on for a month, where they are miserable, they are having persistent cough, they're not able to sleep, and their chest walls are hurting because they're coughing so much, their diaphragm is hurting because they're coughing so much, their voices are hoarse. So all this because of lack of immunity and unable to mount a response. Now what about this? The patients come and say, oh doctor, I have a cold, I need antibiotics.
Most of the people, they believe whenever they have fever, scratchy throat, they need an antibiotic, and they think it's most probably a bacterial infection, which is not true in most of the cases. Even people come with the bronchitis, sometimes with a cough, asking for a antibiotic, which is not true, because 80 to 90% bronchitis is viral actually. So the antibiotics does not work.
What about people who are saying, oh, I take echinacea to prevent cold, I take vitamin C to prevent cold? Is there any truth to it or any merit to it?
People have tried multiple things, Dr. Reddy, to be very frank.
And in my gut feeling, it doesn't work.
It doesn't work that much.
Unless you have immunity against the virus,
absolutely right.
You are not going to protect yourself.
Absolutely,
if you are
Dr. Reddy.
exposed to it. That means protect your immunity, but not just spend time taking vitamin C or echinacea. And these are all gimmicks. They are not going to help. But if you sleep well, wash your hands, and unload stress, the chance of having infection is very low.
True.
And even if you do have infection, it's going to be a very milder form. The higher your immunity, the less powerful the infection is going to be when it attacks you. And don't insist on getting antibiotics every time you're sick. Don't bug your doctor and say, I want antibiotics, because taking antibiotics, you think, oh, I'm protecting myself. Wrong. By taking antibiotics, you are wiping out your gut bacteria, which entirely puts you in a different mode. Now, once you wipe out your gut bacteria, you have secondary bacterial infection like C. difficile. Once you get C. difficile, you start having severe diarrhea, bloody diarrhea. You have other complications. You have to be on medications. You may lose your colon. You may have to be admitted to the hospital. You may actually have to ask for someone else's fecal transplant. That means you'll have to beg someone else's stools to be implanted in you. And why do you want to go through all these things when you absolutely don't need to take antibiotics? So be careful. Don't just jump in and say, I want antibiotics just because you're sick. Find out if you have an infection. Only if you have an infection, if it's confirmed because of a bacterial infection, take antibiotics. Otherwise, just don't give your kids, or don't take antibiotics just because they are available.
True. And then also the resistance to the antibiotics. That's one of the scariest things ever. That's keep on telling us. The Infectious Disease Society and the hospitals, when we go to, they always talk about don't give antibiotic, because you're going to keep on giving antibiotic, and the bacteria are smarter. They are also living organism. They are learning. They are evolving. They are very smart. So there is always a chance when you need an antibiotic, those antibiotics you are actually now resistant to, and the infection is spreading. Work. Absolutely, Dr. Reddy. That is always a chance.
Now let's come to the most important topic today. Influenza and heart attacks. Colds and heart attacks. So first question, can people with colds have heart attacks?
That is true, Dr. Reddy, and you have a literature, and then they are talking about
this was published in New England Journal, January 25th. And it's a very interesting article where they talked about acute myocardial infarction, that means a heart attack after influenza. So the question was, is it just influenza that causes heart attacks, or any virus can cause heart attacks? they say that any virus, any respiratory virus, when it causes infection, can cause heart attacks. But they also go on to say that if you take vaccination, it tends to protect you and decreases the intensity and severity of the infection, so it may protect you from having heart attacks. May, but does not protect you for sure.
So, Dr. Reddy, what is the critical period? If I have a flu, what is the critical period for me that I should be actually watching out for? That
As per the article, it says from the time of infection, next 7 days. The 1 week during the influenza infection or any respiratory viral infection, you are at the highest risk for having a myocardial infarction or a heart attack.
So this time period can extend also, Dr. Reddy?
They are now saying that it could also happen 1 or 2 months later once you get infected with influenza, but the highest incidence happens to be in the first 7 days. So then the question is, why would a person with influenza have a heart attack? Well, once you have infection, you increase the stress on the system as you discussed. 2, you're also increasing the inflammatory markers in the artery, which again puts you at risk for destabilizing the plaques in your arteries. So destabilizing the plaques in your arteries. 3, you're also putting yourself at, you're decreasing the immunity. When you have all these 3 things, stress and strain on the plaque, you are more likely to make the unstable plaque crack. Once you crack the unstable plaque, you are converting a 10% and a 20% plaque in the artery which is unstable, which ruptures and then within 2 seconds closes the artery and you have a heart attack. Now that brings up a next question. They never talked about the incidence of strokes, because strokes can also happen because of plaque ruptures. So nobody looked at influenza and strokes, but if it's causing heart attacks, I wouldn't be surprised if it's causing strokes as well. But since they didn't report it, we won't talk about it. But as of now, remember one thing, if you have influenza and you are under stress, you are certainly at a very high risk for having heart attacks. Why? Because of causing inflammation in the vessel wall.
Now, is there any special group of people who are at risk, Dr. Reddy? Is that person with a heart disease, person with a diabetes? Do you think, again, people who are 65 years and older, are they at risk of having these issues and all those?
So that's a good point. Yes, if you are immunocompromised, you're definitely higher risk. If you have diabetes, you're definitely higher risk. If you have high blood pressure, diabetes, obesity, and diabetic complications, you certainly are at higher risk. That's point number. But he also mentioned something. In the context of chronic atherosclerotic vascular disease, that means you have chronic plaque formation, and infectious illness may cause an acute coronary syndrome, meaning what? You have a plaque in your artery, and you get infection. Once you get infection, you are now making the plaque from a stable to unstable plaque. And once you make the unstable plaque, you're causing the plaque to rupture because of acute inflammation in the plaque. You're also increasing the stress on the plaque because of your increased heart rate, and you're causing vasoconstriction of the artery because your blood pressure also tends to go up. When you have these 3 things happening, you are risking the rupture of the plaque, which in turn leads to acute heart attack. It's amazing how they linked it. So, but if you have diabetes, you're at high risk for plaque.
True. So
if you have been on vacation and you've been eating a lot of wrong stuff, you're going to create a plaque. Once you come in and you get influenza, you're going to rupture the plaque and have a heart attack, even though you're not exercising. And if you have influenza and you decide to go and exercise, you're more likely to rupture plaque easily than the person who is not exercising, who is resting in bed.
True, Dr. Reddy. So what symptoms should I be looking, Dr. Reddy? If I have a flu and I have the risk factors, I'm a diabetic and all those, what symptoms should I be looking at?
You can't look for any symptoms, because when you have a heart attack, it happens in 2 to 3 seconds. Meaning what? If you have influenza, or if you have any viral infection causing you to have a cold or influenza or A and B, whatever it is, you need to rest. If you're not resting and you develop chest pain or shortness of breath, get to the hospital immediately, call 911, because that could mean that you are having a heart attack. Let me start again. If you are having symptoms of chest tightness or sudden onset or shortness of breath, get to the hospital by calling 911, because you cannot look for symptoms. Until you have a heart attack, you have no symptoms. The moment you have a heart attack, the symptom starts. From the time of heart attack to symptom starting is less than 3 to 4 minutes. Wow. That's it. Because up to that point, your plaque is 10 to 20%, and you've had this plaque maybe for 10 years, or you had this plaque for the last 2 weeks, but it is not causing any symptoms. But inflammation makes the plaque unstable, which cracks the plaque and closes the artery, and you have symptoms. So get to the hospital if you're having symptoms.
So it means we don't have any medications. The most important thing is a rest.
Good point. What medications can I take to stabilize the plaque? Nothing, because you're causing a wound in the artery and that wound is ready to crack. So all you have to do is rest. and take the medications. When you take medication, Tamiflu, you are actually decreasing the virus load and helping the body heal and helping the body fight the infection. 2, you're resting. 3, you're hydrating yourself, not drinking a lot of coffee, but hydrating yourself. 4, you are also eating foods sparingly, you're not a glutton eating the wrong kind of food. So when you're not doing that and you're staying in bed, the chance of having a plaque rupture drops dramatically. So that should be a priority, not because you have flu and influenza, but you still have to go to work and work hard and put yourself through stress. That's when you have a problem.
One more question, Dr. Reddy. You mentioned about the caffeine. A lot of people, when they are sick, they start drinking hot tea or green tea or some other tea ingredients. Are they safe?
Stop. That is a good question. When you drink hot tea, green tea, iced tea, black tea, coffee, what does it have? Caffeine. What does caffeine do to the heart rate? Increases. What does caffeine do to the arteries? Causes vasoconstriction. What are the 2 things he said? You are increasing the stress on the vessel wall by increasing the heart rate. You are causing vasoconstriction. You're also increasing your stress hormones by consuming caffeine. When you increase your stress hormones, what are you doing to the plaques? You're putting enormous stress on the plaques. Then you also, because of inflammation, you're causing increased risk of increased inflammatory markers in the vessel wall. And you're increasing the biomechanical stress by consuming caffeine. When you do these things, are you putting yourself at higher risk for plaque rupture and heart attack or no?
Absolutely, you are.
So is there a clear way to look at it? Should I be consuming caffeinated products when I'm sick and trying to rest? The answer is no. Should I be drinking lots of liquids? Yes. Can I drink Gatorade? Maybe. That's not a problem because it's not going to give you caffeine. Can I eat a lot of soups? Yes. Oral rehydration is the best way to protect yourself.
What about the salt, Dr. Reddy? Is there an indication?
When you consume, that's why first thing I said is hydration. Hydrate yourself well, means drink a lot of water. But if you eat a lot of soup, soup has got a lot of salt, which again is going to suck the fluid back into the gut and make you volume depleted, which in turn puts enormous stress on the body. So when you consume soups, you also need to consume a lot of water to hydrate yourself. One other interesting thing I found here was, of the influenza viruses, of course, all the viruses are notorious for causing plaque rupture and heart attack. And 2, of the influenza A and B, even though influenza A is more common and that's where the vaccination is given, influenza B has been associated with higher incidence of heart attacks compared to influenza A, which is interesting. That's what the article said.
Yeah, that's what the article said. And the vaccine contains 2 strains there is a trivalent vaccine and the quadrivalent strain. The trivalent vaccine actually contains 2 strains of influenza A and 1 of B. And the quadrivalent actually contains 2 strains of influenza A and 2 of B. That's what we give. And the Tamiflu, we always give it for both influenza A and B. But that's true that the influenza B has been mentioned in the literature to cause more
heart attacks. But does Tamiflu work on influenza B as well?
Influenza B as well.
Does it work on influenza C?
Influenza C is not... in the literature, it's been mentioned that influenza C is not a culprit to cause that much epidemic or pandemic compared to the A and B.
So just suffer through it.
But only question is that, Dr. Reddy, if I have, so it means that you're saying that swab is very important to find out which flu you have. Because
right. Because when you do a swab, you're able to find out influenza A, correct? Influenza A or B. But can you also find B?
Yeah, because it's some of the swabs that can tell you between the A and the B which influenza you have.
Which is good. So if you're B, you better be more careful and protecting yourself because you don't want to have heart attacks.
But then also you mentioned about, Dr. Reddy, whether it's a B or A or it's other viruses, they all can affect the heart.
That's right. They all can affect the heart, but of those, so how can they affect the heart? 1, they can cause heart attacks. 2, they can affect the muscle and drop the function of the heart and put you in congestive heart failure. 3, you may end up being in congestive heart failure for the rest of your life, or you could belong to the 60% of people who will recover their heart function. But at the end of the day, why do you want to put yourself through all this? Thank you very much. That was an excellent presentation. You did a phenomenal job, and I am now very well informed about flu and resp. So there's a difference between flu and cold. Flu means you have fever, chills, and headaches and runny nose, and it is influenza virus, usually influenza A or B, sometimes rarely C. But when you say cold, you're not talking about flu, which is also a cold, but you're talking about other respiratory viruses causing cold-like symptoms, but not influenza. You may have fever, but you do have a lot of runny nose, scratchy throat, and everything else.
And the most important thing that remember, the symptoms can be similar. The prevention stays the same, and it can also affect your heart. It can again cause pneumonia and the complications. All these viruses have a tendency. So most important thing is the prevention and the vaccination.
Protect yourself, otherwise if you have a heart attack because of influenza, that's bad news. And if you develop congestive heart failure because of influenza, that's bad news. And we are seeing a lot more cases this year compared to previous years. That means something has changed in the virus and it seems to be going after the heart.
And it's probably the cold, and this year people travel a lot and the weather is changed. Maybe that is the reason that we are seeing a lot more cases this year. And also a lot of the patients are now refusing the vaccine, which is another topic that we have to sometime cover.
So stay tuned. Next time when we talk to Dr. Khan, we'll be talking more about vaccinations and what are the different types of vaccinations a person needs to take. At what stage in life should you take pneumococcal vaccine, shingles vaccination, chickenpox vaccination. All these things will be discussed in the next few videos. And also the next video I think we'll do is on strep throat. And what's the difference between sore throat because of strep infection or other infections? How do you find out? What do you need to do? Do you need to take antibiotics? At what stage should you intervene? And should kids, when they develop strep, should be aggressively treated or ignored? And what are the chances of rheumatic fever in this country with strep throat in children? I want you to be aware and stay tuned and look forward for the next segment. Once again, thank you, and I hope you enjoyed the segment. If you have any questions, please email us your questions at info@reddycardiology.com. I repeat, email us your questions at info@reddycardiology.com, and we'll create more videos and put them out. Thank you.